is depression? Jeffrey Edwardson once said, "Depression is like a bruise that never goes away, a bruise in your mind." The word depression can be misleading. Everyone has felt depressed at times, such as setbacks in one's career or ending of an important relationship. For most people, the sadness is temporary. Major depression disorder is more than just temporary feelings. It is relatively long-lasting. You can get worse over time and significantly interfere with a person's daily activities. Depression is the most common mental health disorder. Often, anxiety disorder is affected 7% of adults in the United States in any given year, with a time prevalence of 21% of all Americans, according to the World Health Organization. It is the leading cause of worldwide disability. Men and women are experienced depression differently. Women are affected at twice the rate of men, while men with depression are more likely to die by suicide. There are more gender differences in the way symptoms are experienced. Depression does not discriminate on age, gender, or race. In fact, two factors, ethnic identity and religious participation, seem to function as protective factors, lowering risk for depression. The National Comorbidity Study Republication reported a higher prevalence of major depression in whites than non-Hispanics and black Hispanics. The prime age to risk having depression is 18 to 43. However, depression does not discriminate on people in other age groups. 2.5% of children and 8.3% of adolescents in the United States report dealing with depression. Many with depression also deal with other medical disorders. They can have heart problems, migraines, high risks of cancer, anxiety, eating problems, problems with substance abuse. Depression is highly influenced by genes and the environment in which you live in. Many people who have depression in their family are more likely to deal with depression compared to someone who does not have depression in their family genes. When determining if someone has depression, you see if they have symptoms in the past 2 weeks that are some of the following: a depressed mood for most of the day, loss of interest or pleasure in activities once enjoyed, weight loss or weight gain, not on a diet, directly sleeping or being overly tired, restlessness or feeling slowed down, fatigue or loss of energy, feeling worthless or guilty, a lack of concentration or difficulty with decision making, thoughts of death or suicide. Ways to treat major depression vary. Major psychodynamic therapy, which is a client sitting face to face with a therapist and a therapist asking questions, suggesting helpful behavior, and giving opinions. CBT has seemed successful in treating depression as well. You can get medicines to treat depression, like MAOs, tricyclics, and SSRIs. All of these medications have lots of side effects, like nausea, diarrhea, insomnia, raised rashes, low blood pressure, high blood pressure, weight loss, weight gain. Also, you can try electroconversion therapy to treat depression. This is done by electrodes placed on one or both sides of the head. Bilateral ECT is both sides of the head, while unilateral is where they are only placed on one side of the head. This treatment is only used as a result of no success with medicine or other treatments. Depression is a serious disorder. If you know someone who is affected, try to understand that it is hard to deal with. For all things You must ask for help, and it is hard for someone with depression to ask for help. Be mindful that they don't feel that anyone will understand.